Hello.
Howdy. How goes it?
Good.
You can see both you guys in one day, and I saw the mother of your family here a little shortly.
Well, there's 12 of us.
So the odds are good. I see you know somebody.
We're supporting you. Well, the other 5 are Roy Lowe, so otherwise you get them too.
Oh, nice.
I think.
Yeah.
Depends on
my behavior maybe.
Well, I figured we could have family discount.
Family.
Big.
Speaking of big, we got your big picture. Now tell me, your wife said you just finished all your antibiotics?
Yeah, what I did is when I was taking 4 a day.
Right.
And I figured if I just quit all of a sudden, I would be, so I went down to 2 and just did. And I got no pain.
Okay, that's my next question.
Whatever it was, when that filling broke off, I think it irritated. That's it was down here.
Yeah.
That's why
There's like no swelling now.
and I've been not chewing on that side. Soft stuff.
Right, yeah, for that part. Yeah. Because, we've got we still have an infection and a break. Just like with your wife, we're talking about sectioning here and removing the piece of the bridge that's left and keeping the front piece, just like I did with hers. And now the only difference is she had an upper, you have a lower. The bone's a little different on an upper and lower. So, and I think you're going to have a bigger area of infection that was destroying some of that bone there. Just, you got a pretty good sized dark spot here underneath too. So, basically the same thing I did with her. I'll bring you in, section it. And that's why I kind of wanted to look at you today. I didn't know if you were where you were at. I mean, it sounds like you're doing okay. I thought if you were still having some pain, I'd do it right now. But earlier, yeah. If that's the case, we could just schedule it, next week or something, whatever works for you.
Well, financially, that's the other side.
Yes.
And we just put up at $600. As long as it ain't hurt, I'll watch it. If it starts to hurt again, maybe an antibiotic.
Yeah.
I'd like to, like a breather in between.
Okay. Yeah.
Unless you want to send me to a mall and you have to get a stash on it.
Yeah, I don't think that's going to happen. I don't know. You kind of have to play that by ear, I guess, a little bit. I mean, if you're getting any sensation at all, we should. I don't know if I'd want to leave it like for months and months because it's gonna it could blow up a local and something like that.
Well, no,
yeah, play it away, I guess, when you can afford to do it. But you have some antibiotics too.
Do I have them now?
Yeah, I could write you another prescription just in case it starts to.
But I put it off. Try and put it off for a month if I can.
The big expense question mark will just be what happens when I take the root out. Okay, that's the variable that I don't really know. Like I was explaining to your wife, hers came out in a whole bunch of pieces. It was kind of like I just digging little pieces out there. But the actual bone around it wasn't bad. With that much infection under there, you might have just this big void in your jawbone. And if that's the case, then I usually want to put bone down into that thing so that your jawbone isn't good. I'm packing some bone to preserve bone. And that's important on the lower, like I told you, a lot of people definitely get away with that. So.
And there's no guarantee that the front part of that tooth is going to be good.
There's not, but it looks good at this point. I mean, it looks. Yeah, that's the other thing. I don't. The other reason you have to do it because this thing kind of torques the whole. So this back piece moves and then this front gets torqued. And with that front getting torqued, it could wreck that front tooth. That's my bigger concern is that it would get wrecked.
You have to go to the Delta first, right?
Oh. You mean like a pre-authorized thing or something? Hey Lisa, Let me see if she can answer that. I don't know those billing questions too well, but hey, Lisa, you got a billing question on this Delta thing? Or Claudia, either one, somebody that gets stuff with that. But I'll just get back to, yeah, that's why I don't want you to chew too hard on that thing, because for this other too. You've been probably babying it anyway.
Well, yeah, because I want it aggravated. They seem to collect stuff.
Down in here, probably,
Yeah, I put popcorn.
yeah, everything goes into that hole. Come over here, so here, stand over here so we can see you. He wants to know where to go. You have to send him home out of time, or can you just?
I already did that.
Oh, you already did that.
For me?
Yeah, I already did it for you.
Oh, well, there's no there.
Oh, because we talked about it.
I talked
before you
about
got
it.
here.
After your wife was in, her and I, we've talked at lunchtime.
Yeah, so I already sent in the pre-authorization. I know that they will cover the extraction, but I will not cover the bone.
They won't cover them.
The bone.
Bone. Okay, so if we put bone in.
So what are we looking at?
$500 out of pocket if we have to put the bone, because the bone is $450 and it's not covered. Now they're covering the extraction. Out of the $200, they're going to pay $150 and your portion being $50.
And then what's left?
Well, then that's the next step. Okay, after we get, in your case, letting things heal, like with your wife, or maybe a couple months. So we have to decide if you want to go with a partial, which you had before, what it is, and the work, So, because there are only two options here are a partial or an implanted, probably 2 implanted teeth. Do they run? Those are expensive. Those are. Now, if you do a partial, you can't. A bridge just means it's fixed, but yeah, you meant a partial. It's removable, so it's a removable partial, which is how much it was.
About $1,500 cover half.
And then,
So on Sylvia's, then she isn't. We paid for removal
And the partial.
well, she's got the partial.
Yeah, but she didn't have to have bone.
yeah, I don't know that until I get into
So we're looking for 500.
Both of you have to wait a while. And I think I told her too is, did you try the partial? I mean, you had one. She's like, yours seems to work.
The upper works fine. I don't know about that one on the bottom.
I don't know. I mean, they're all different. I tell people you can try them because they're relatively inexpensive compared to doing implant work. And if you decide that you don't like it, you can do the implant later. So as long as you got enough bone there. Does that affect the insurance?
No, I just thought that if there was anything else we were going to be replacing on the other side.
Well, that is partial here.
I meant for the lower, we're doing a lower partial.
Oh, well, we did have to discuss, we've got the carrier.
We had the gum therapy. Oh, yeah.
Oh, you got, okay.
We had the 3 quads of gum therapy that he was diagnosed with back in
You got a lot
November.
you got a lot of buildup, you got a lot of buildup on your root surfaces there, tartar.
That's back in November, and most of the stuff's not doing anything.
Okay, so we get that down. Well, yeah, you got these 2 teeth above it, so you would probably want something. Your question was, am I going to, these all look like they're going to be solid once they get all cleaned up. So it would just be a unilateral or one-sided, just like your upper. Same thing.
Except it goes under the tongue.
Yeah, it's a little different. Yeah, right. Your tongue plays with it.
Well, you can have some time to decide if you want it also, because you're going to have that removed, and you could see if it becomes cumbersome for you to eat, or if you end up favoring the other side, if you even want to invest into a partial.
This side I've hardly ever chewed on because the partial itself is.
Is it opposite sides?
Yeah.
So we might not want the teeter totter.
When you chew meat,
I know.
a partial is just.
I know. I tell people that. I mean,
they're all right. I mean,
they're all right.
The gap.
Right.
In fact, what I was wearing it constantly, because Dr. Franklin and I, after I had the partial put in, using the appliances, he called it, I'd take it out every night, like he said, and I was found that I was putting pressure somehow on the lower teeth at night, on this side.
Where you're gritting your teeth.
Well, that's it. So he said, well, you just leave it in. And I've been fine. Well, you and Marcy got on in, you said there's red over here, you should take it out.
See, it's all red. Yeah, you do want to take it out.
Well, the thing is, I took it out, and within a week,
well, that thing was gonna go.
yeah, but within a week,
it just went
all of a
faster.
sudden the feelings coming out.
Yeah,
You know,
it just went faster.
so I must.
You must grit your teeth.
Favorite
Yeah.
At night.
At night, yeah.
I just
right.
never realized.
No, you're just, well, most people don't know
But with the appliance in there, it didn't put the pressure on the back too. So,
Kind of like snoring. My husband says he doesn't snore because he doesn't know because he's sleeping.
two of my boys are on the sleep apnea.
Yes, right.
Mask.
Yeah, we've been talking about that all afternoon.
And Michael, he's wearing it now. The first night, the kids couldn't believe it. Dad was in bed and there was no noise.
Yeah.
I mean, they have to go to bed
Right.
indoors.
Yeah.
Yeah, because it's so fun for me.
We go up to the cottage. My older boy, my other boy, would sleep in another room with me.
Yeah.
Rather than be out there in the same room with him. It's that bad.
Well, the dentists have gotten involved in that now because we can make these appliances that move your jaw forward. And we've been talking about that at lunchtime too because we have so many people that, yeah, they have the CPAP and it works, so we know that it can work. They hate the stupid thing dragging it around and taking it on trips and stuff.
There was something new on the radio the other day about they call it no mask.
It's an appliance.
Is it an appliance?
Yeah.
But
Yeah.
no mask.
Right. There's all kinds of things
it's
coming up.
fun to,
Yeah.
Matt's the seal slip. And I was bedroom at the cottages here, and he was right outside of the room. And all of a sudden, you hear this.
The thing's blowing air. It's pressurized air.
I mean, it was just. You know, I got up and I walked around the corner, and I heard this cat. So I shook it. And I said, hey, I says, you're making noise. And I go, oh. God.
Yeah, amazing how that thing works. Like your charm. You just gotta get some air in there.
Well,
Yeah, another one of those things.
I told them both, I said, if you read the book, it says lose weight and exercise.
Yeah, there you go. Easier than a
That
machine.
is a lot of it because my husband lost a lot of weight and he doesn't snore.
That's true.
And I keep poking at him and he's like, well, you got one, Dad. I said, yeah, but I'm 76. My exercise is getting out of So,
No, are you guys going to do that today or?
Well, we were just talking about it today.
Okay.
He's not having any real pain right now. So I didn't know if he was having pain, but he's not. So we could schedule it.
Okay.
It is not swollen.
yeah, I was wondering, we paid for Sylvia's up front. Can we pay for mine when it's done? That would help.
Yeah.
You follow?
Yeah. Okay.
It is,
You're gonna have her money ahead.
Yeah,
I told him my main concern is just that it's going to torque and we might wreck this tooth.
Right. Now, I wouldn't mind seeing some of the gum therapy done before we start to
With the gum
extract.
therapy, the last time, the 120 each time.
I
It
know.
all
But
costs
the thing
something.
is, it's just like building a house that doesn't have a good foundation. If you're not taking care of the gums and all the surrounding issues, then anything restorative that we do.
Agreed.
It's a
You
budget.
need a janitor.
Right.
Right. No, I'll do what you can do. And I just want to make sure I discussed it with you.
Yeah, it's going to come.
Okay.
My job is to tell you, give you the information as much as I can. And,
He might already be a script for you.
I do that.
I'll
Okay.
listen.
Well,